Well, thank you for joining us back here on the Cardiovascular Digital Health Channel's broadcast with Mr. Gary Shapiro, who's the president and CEO of the Consumer Technology Association, the largest association of its kind of consumer technology companies, and including over 2,000 American companies manufacturing consumer tech. Mr. Shapiro is a futurist, a visionary who has several books, including Ninja Future, Secrets to Success in the New World of Innovation. We just had a great segment talking a little bit about the opportunities in this space for consumer technology groups like yours to help establish standards, help increase the pace of change and delivery of new devices that can measure and impact health to the medical community. I want to pivot because you are also a part of a medical family, and your wife is a practicing physician. And so I think she shares the experience of many of our readers, contributors who are involved in not only digital health research, but practice of medicine and digital medicine in the current era. And to be honest, Gary, it's a difficult time because we're caught between two worlds. And many of our practices are rooted in older practices. We've had implementation of electronic health records recently, and actually even more recently, opening or unblocking, for example, of a lot of the data in electronic health records. And many of my colleagues, and I sometimes also, struggle to see these technologies as help. In some cases, some of the technologies that we use, not necessarily consumer technologies, but technologies like in the electronic health record, impose some challenges. So I'm really interested to hear, if you wouldn't mind, some comments about not only from the user consumer perspective, but from the healthcare community perspective. What are some of the changes you see coming? What are some of the opportunities to use technology to deliver better care and deliver it more efficiently and in a way that's more rewarding for healthcare providers?
Well, that's a big question, and there's no question that we have changed dramatically in the last several years. I mean, when the electronic medical records became mandatory because of financial penalties and incentives, there was a big change. It was so disruptive for a year or two. It was a constant complaint I've heard at every medical conference I attended. And a lot of older doctors retired. They couldn't deal with it, and some of them still can't deal with it. The transition was painful. And frankly, it has benefits and minuses. I mean, the minuses right now are, especially in the beginning, where that you're looking at a device rather than the patient. I think that was the biggest one, and it took a lot more time to learn. If you worked at different systems or different hospitals, they all have different things, and they don't communicate well, and there's no financial incentive, frankly, or reason for different hospitals to communicate with each other. So the benefits of electronic medical records in part have not been met. Some of them have been met in that it's a lot easier to do retrospective research and do analysis of data. My wife's having a paper published because she's able to do that for 10 years worth of data that she wasn't, and it was a lot of data, and you can number crunch much easier with those records. Moving forward though, we're also dealing with new devices, new ways of getting a tremendous amount of information. The one thing COVID has taught us is that we can actually use these devices as well by consumers as a way of communicating with them, as a way of getting the information, even as a way of assessing risks. And we're going from just consumer grade devices, and the professional grade devices are moving quickly into the consumer area. Sometimes the difference between a professional and consumer device is not that great, especially as economies of scale kick in and things get built in all sorts of ways. I mean, there's certain things we're always going to have to physically be with a doctor for. Some would argue surgery, not others. There's automated surgery, as you know, and there's ways of looking at things. And I have an argument with my father-in-law as a cardiologist. He thinks that devices will never replace humans looking at EKGs. I think they will. He has been a cardiologist for a very long time, and he thinks they won't. It's an art. It's not a science as much to him. So we'll see. I think artificial intelligence will make a difference in that. In terms of some of the other barriers we are facing, because of weird laws, a fixed number of doctors in the United States, yet we have a growing population, and especially a growing aging population. They're not only getting older, we are all getting older, or the cohorts of baby boomers and others, but We're living longer. So we have tremendous need for doctors, and they all have a limited amount of time. So we need efficiency. And efficiency is so important. So telehealth and COVID have pushed us into that age quicker than perhaps we would have wanted to go. But now that we're there, we're seeing the benefits of it. And patients' perspective, my wife tomorrow will be in our home seeing 30 or 40 patients with telehealth. They'll have gone to her office to get the technical measurements she needs to do her job, but there's not a doctor there. She'll read the results and have a conference with them. She'll be able to see their face one-on-one and talk to them. And the caregiver can be there. So that's a good thing. We'll also have devices in the future which will do more and more things. And we're seeing that right now. The new Apple Watch, for example, is measuring all sorts of oxygenation of the blood. It can measure blood pressure. There's all sorts of sensing devices that continue to come into being. It's just a matter of cost, creativity, and getting that data and making it usable. And it's a matter of also cost for society. The technology allows a value-based approach to healthcare, which is so important. We have to start looking at things like the cost of transporting patients back and forth from an office, the cost of the caregiver's time, the frequency of the treatment. Right now, we've created an incentive-based system where the frequency is often created by the drug companies themselves. And they are doing tests and creating tests and testing paradigms, which is a frequent treatment. Well, you know, sometimes you don't need that frequency of treatment, and there's no financial system which allows it or looks at other treatments. For example, I'm on the board of the Focused Ultrasound Foundation. I've been attending their conference all this week. They have a whole bunch of treatments around the world which are outpatient treatments for all sorts of maladies that have been approved by the FDA, cancers and other things. So that Focused Ultrasound is a device. It's not a consumer device, obviously, but it's a device that's used in an outpatient setting in most cases and has results that are comparable, but without all the chemotherapy, the radiation, the surgery, other things that may be required. It's an alternative treatment. And one of the keynote speakers this week who talked about that was a Nobel Prize winner in cancer and healthcare. And he talked about the fact that once you have a cancer patient that's good for 2 years, they're going to likely be stable. So we got to figure out how we keep them alive for those first 2 years in many areas of cancer. And that's something where technology, consumer technology, medical grade technology is an answer, as are new forms of treatment. So put all that together, and there's a lot of options out there. It's a matter of figuring out which are best, marrying them. I think our federal government is ready. Congress is ready. There's legislation before it in all sorts of areas now that I think would be bipartisan, that allow some of these things that are basic, like working across borders, for example, or being reimbursed for the time you spent in a telehealth call. It doesn't have to be the highest form of complex level 4 billing, but it's something which you can have at least be paid for your time in a meaningful way. And that's important that the system work that way. So there's a lot of changes which are still happening. There's technology which is coming. There's no shortage of great innovators around the world that are working on this. And this is a global issue. And no one has a monopoly on intelligence in this area. But I'm glad there's a journal that's focused on it finally. That's why I'm so thrilled to talk to you.
Gary is not paid for that endorsement, by the way. But thank you very much, Gary, for the shout out. So I think you've taken such a big, almost impossible question that I asked you and covered it systematically. And I really appreciate your comments that just demonstrate the breadth and depth of your knowledge in this area. So I want to just end this second of our 3 segments with the following tease for the next segment, which is number 1, I'm really interested to hear from Gary what we in the healthcare community at the professional society level can do better to work with technology associations and technology companies like yours to establish some of the standards and guidelines for this new practice of medicine that incorporates consumer wearable devices. So that's one element. And the other is, I'm really interested, since you are a visionary, to think a little bit about job creation and the healthcare team. And are we in need of a new phenotype, if you will, of healthcare worker who's able to integrate device data from commercial wearables, interpret perhaps outputs from artificial intelligence algorithms, almost like a health data engineer, if you will, who could create and package meaningful information for clinicians, or are clinicians going to become more like engineers who are going to go in and interpret data directly? So stay tuned, because I hope to cover those in our next segment. And again, Mr. Shapiro, really appreciate you joining us on Cardiovascular Digital Heart Journal's webcast. So thank you again.
Thank you.